you can use the Socrates mnemonic. Yes, the site, onset, then character, then relieving factors, alleviating, exacerbating factors, and so on and so on. So you should characterize every pain in your patient in such a manner. Is it a chest pain? Is it an abdominal pain? And so on and so on. So this methodology should be employed in your approach to the patient. Why? So that you couldn't miss anything. To miss anything is, well, to do a crime, yes, in a sense. Because if you miss this, you can give improper diagnosis, incorrect diagnosis, and you give improper treatment, and your patient will deteriorate or die, or even die. And this death will be on you. Of course, it's not a reason for suicide, for example, yes, because they say that every good doctor has his own symmetry. Yes, every good doctor has his own symmetry. It's true, yes, unfortunately, because, well, even there was even a wise saying maybe 1.5 years ago, yes, some wise person said that when I will choose a doctor, when I'll have to choose a doctor, I will ask how many dead people, dead patients do you have. So if the patient, the doctor has a lot of dead patients, it may mean that the doctor is not good, yes, but it also may mean that doctor takes very difficult cases, yes, does not avoid very difficult cases. You can always avoid almost always avoid difficult cases by just referring a patient, for example, yes, or just, well, escaping in some way, yes. But if you stick to the difficult patient, yes, and if you are not afraid of difficult patient, if you are not afraid of dying person, yes, it's very difficult to be with the dying person, because the dying person is in despair, yes, is in real despair. Many people who are dying are despaired, yes, and of course it's very difficult to be with them, because their despair is infective. You can infect with this despair, yes, and sometimes you think that what if there is nothing there, yes, beyond, in the beyond of this life, yes, and well, it's a despair for you also. So, virtue of method. So in every your action, in every your assessment, there should be a method, That's why we have 3 stages of diagnostic process, by the way, and we are teaching these stages in our department. Yes, first stage is when we talk to the patient, just talk to the patient, we take his complaints, history, and so on and so on. Then we make a short conclusion. Then there is second stage, which is physical exam. We make a physical exam, we perform a thorough physical exam, and then we make another conclusion, another short conclusion, and only then we perform instrumental and laboratory studies. This is the third stage of diagnostic process. Only after all those 3 stages and after synthesis of these 3 stages results, we can make a proper diagnosis and make a proper treatment. Of course, in many cases, the process of diagnosis shrinks. Yes, it shrinks. For example, if you are an emergency doctor, of course it shrinks, because you ask, what do you have? I have an acute chest pain. Okay, let me just auscultate your lungs, auscultate your heart, then we'll perform ECG, then we'll perform troponins, yes, and I will refer you to the ICU where they will perform stenting or maybe thrombolysis and so on, so on. So the diagnostic process shrinks to 5 to 10 minutes in this case, yes, but there can be such cases such as fever of unknown origin, for example, yes, in which the diagnostic process is very, very, very long-standing, very long, so it can last for several days or even months, and the patient has no exact diagnosis. So, well, every case has its own peculiarities, features. So, virtue of method. Then, third quality, very important, you can develop it while being here in the medical university. Thoroughness. You should observe, record, tabulate everything and communicate everything. So you should just not only observe, you should record it. You should make an assessment by recording. Because when we record something, we make a second thought of it. We make it more precise. We have some insight. Yes, because you know that we have the underconscious, the some undermind, yes, which analyzes, which keeps analyzing all the facts, yes, despite you may be thinking about anything else, you may be watching TV, you may be talking to your patient, but your subconscious mind keeps analyzing important for you facts that are important for you, yes, it keeps analyzing. For example, you remember the periodic table of chemical substances. Yes, it was discovered by Mendeleev, a Russian scientist, a great Russian scientist. Yeah? Well, he saw it in his dream. But it was not a revelation. It was not a God's revelation. Because he just thought about it for a long time. Yes, he gave it a very deep, thorough thought. And it was, every brick was combined into a wholesome picture, only in his dream, yes? And he just remembered this notion, this idea from his dream. And when he just wake up, he just made a drawing, he just recorded it, this dream, yes, was recorded, and thus he was a discoverer of the periodic table. So it was not an insight, some revelation, some mystical revelation. It was just the work of his subconsciousness. So thoroughness, observe, record, tabulate. What is tabulate? Classify it. Classify rare cases, not very rare cases. You should just tabulate everything and then communicate. Not just take it inside yourselves. Yes, and that is maybe the most important reason for the existence of our student scientific society is that you could have an opportunity to deliver something in front of an audience, to talk in front of an audience, to make your knowledge known to the others, to share your knowledge. This is very important, because when you share your knowledge, your own skills, they just are strengthening by just sharing. Because while vocalizing your thoughts will become finer, your thoughts will become a bit different. You will have an opportunity to change them, to adjust them. And this is very, very important, very interesting. So you should be able to communicate the results of your observations, to communicate them. And fourth quality, it will be very, very handy during your clinical years, grace of humility. So what is grace of humility? Well, yes, to err is human. Yes, you know this. Everybody has his own mistakes or errors, yes, or even, well, blunders. Yes, doctors also have errors in many cases. Error of judgment. There are many cases, and unfortunately, many of us, all of us, will have this or that kind of errors. So, grace of humility. When you get your error, when your error is recognized, when your error is exposed, you have a grace of it. It's a grace, it's a lesson, yes? And when you have errors, when you have mistakes during your quizzes, yes, during your studies, it's not a humiliation. It's not something, it's not a bad experience in your life. Yes, it's a lesson, it's a very good lesson. And to take this lesson with some thankfulness, with gratefulness. It is very good. It is very good, because this lesson will be remembered for all of your life. So you have a grace of humility. As even the most experienced doctor can have humility of error, can have humility of incorrect diagnosis. And in this case, maybe good doctor will not hide this error. Yes, a good doctor will find good words for telling his patient about this error. Yes, I made an error. Yes, but it should be said in such words so that the patient should be afraid. Yes, and you can just adjust, you can turn this error into the direction that is beneficial for both you and your patient. It's an art, yes, but you will learn this. You will learn these skills. So grace of humility is very important, even if you're an experienced doctor. Well, talking about care of the patients, maybe you remember Sergei Botkin, an eminent Russian doctor of 19th century. Yes, there were two great doctors, Botkin and Zakharin, and there were two approaches, yes, to the internal medicine. First approach was clinical laboratory, very progressive, and Botkin was the champion of this approach, and Zakharin was more conservative, as he thought that, well, all those newly invented laboratory investigations are okay, but what is most important is to talk to the patient. Yes, so this was like a psychotherapy. Yes, but Sergei Botkin, he proposed not just using both clinical investigation and laboratory investigation, but he also said, лечить не болезнь, а больного. You have to treat not the disease, but the patient as a whole. Yes, and his words were exactly like the words of Osler, yes, who said that good physician treats the disease, the great physician treats the patient who has the disease. Yes, so the patient is not an entity with a set of signs and symptoms. Yes, the patient is a human being, and you have to take into consideration all the factors, all the emotional, economic factors. Yes, well, for example, you know that there is moral issues such as abortion. Yes, in gynecologist, in any gynecologist practice, there can be such a moral issue. Well, in many countries nowadays, abortions are okay even if there are only social indications for them. Yes, and many religious people consider it improper to perform abortions, yes, only due to some social problems. For example, if a woman is single, or if her husband is not ready to be a father, and so on, so on, so on. But there are such cases in gynecology, in obstetrics, when we have to decide what life to save the life of a fetus, yes, or to save the life of his or her mother, yes. And in this case, of course, it would be very inappropriate if you will not learn the religious and social background of the mother, yes? Because you can just tell her that I've decided to make an abortion, so you'll have to put up with this, yes, and I will perform an abortion because I think that there is a threat to your life. Yes, I will not look at the fetus as a living creature. Yes, and if the woman is religious, yes, she can get a real problem with this. She can get a real trauma. Yes, she can be traumatized by such approach. So in this case, yes, formally, from the point of view of logic, the doctor is right, yes, because he was taught that in these cases he has to do this, this and that. In the case of this, the doctor has to perform abortion. Yes, it's an emergency, yes, but from the point of view of wholesome approach, the doctor should discuss all the options, all the possible options with this woman, and if she insists on keeping the fetus, of course this doctor has to consider other approaches, to consider other options, yes, because this is the holistic approach. In this case, the doctor takes into consideration the wishes of the woman. There are a lot more other cases, a lot more other examples for this. So this is very important, to treat the patient, When you treat, for example, when you treat Helicobacter pylori, yes, you make an administration of 3 antibiotics. Yes, you can just administer these 3 antibiotics, and you can just forget about the patient. You can just send the patient off. Yes, you can tell them, well, it's okay, just take it for 10 days and everything will be okay. But if you will not explain to the patient the possible side effects, yes, almost all patients will experience some discomfort, will experience diarrhea, maybe and so on, dyspepsia, so on, in the first days of this treatment. So if the doctor does not explain this to the patient, this is an error. This is an approach to the patient as to a mechanistic model, as to a robot, not to a human creature, human being. Because if you explain, even the most inappropriate side effects will be tolerated by the patient, because everything that is reasonable is tolerable. Almost everything that is reasonable, it is tolerable. The patient can tolerate it. So it's very important to treat a patient as a whole, but not just sign or symptom. It is very important, but it's not always possible. Well, talking about communication with the patients, I will not dwell on this for a long time, because we'll discuss this in details during one of our next meetings. Essential elements of communication in medical encounters. So when you perform a medical interview, so see, you should build a relationship with the patient. Yes, even if the patient is your patient for 1 hour or for 10 minutes, nevertheless you should build a relationship with the patient. You should get the patient's confidence. Yes, you should just act in a manner to win the patient's confidence. Open the discussion. Yes, what is open the discussion? A discussion is not a some violent exchange of opinions with the patient. Yes, but discussion is when you give your patient right just to express him or herself. Just listen to the patient. Don't treat the patient as a veterinarian could treat his patient. Yes, just listen to the patient. Yes, when you listen to patient, when you agree with the patient, yes, you just listen to him. Yes, you nod. Yes, you, even if you maybe don't follow fully the patient's line, yes, just nod the patient. Yes, so that the patient could have an opportunity to get an impression, that the patient is listened to. Because, well, unfortunately, many of our patients, they have some encephalopathies, because they have chronic diseases, yes, and any long-lasting chronic disease, any long-lasting pain will bring along very serious problems, very serious mental problems, unfortunately. Not psychiatric, but mental. Yes, any pain is well, a pain in the brain. Yes, even abdominal pain is a brain pain because it reflects on patient's brain or patient's soul. So open the discussion. So listen to the patient. Try to understand the worries of the patient. Try to understand the worries. Try to understand the wishes of the patient, and try to comply not with all the wishes, but just with his main wishes, his or her main wishes. Gather information. This is very important. So use open-ended and closed-ended questions. Well, those who had internal medicine with our department, they know what are open-ended and closed-ended questions. Yes, the open type of questions is when you ask, what are your complaints? Yes, and close-ended questions, for example, if a patient complains of pain, close-ended question is your pain severe, for example, yes? So, in closed type questions or close-ended questions, the patient has just to answer yes or no, yes? But these type of questions should be put only after the open questions, yes? So, first you ask, what are your complaints? And only then you make some adjustments. For example, a very useful strategy when you are talking to the patient and the patient begins telling you everything about his or her life, everything about his or her spouse, children, and so on. And all these is made only to single your question, what are your complaints? Yes? Of course, you have to filter the patient's words. Yes, you have to filter the patient's words. You have to filter the patient's complaints, and you have to catch the one of the complaints, one of the relevant complaints. For example, the patient tells you, I had abdominal pain, and then my wife just came and said, what are you doing? And we had a quarrel, and so on, so on, so on. And in this case, you just interrupt mildly, yes, and you just told me that you had some abdominal pain, yes? Please tell me about it in details. And the patient has to tell you about the pain, not about the wife, but about the pain, yes? And you just listen to the words to the explanations about the pain, and when you feel that the patient begins to drift away, yes, you just tell, you said that the pain was severe, wasn't it? So this is the close-ended question, yes, the patient has to answer, yes, it was very severe. And then you ask, where did you experience the pain? And so you just direct your patient in your direction, not in the direction of the patient. Well, it's an art, yes, but it's an easy art. You can achieve it. Then understand patient's perspective. Understand the patient's background, patient's social background, the patient's family, the patient's beliefs and concerns. And you should understand what can you demand from the patient. Will you demand from him compliance? In what kind of compliance can you expect from the patient? This is also very important, because a patient with low socio-economic status, with lower education, well, this patient is, in some cases, the patient is not likely to comply with very sophisticated advice. This patient should be given very up-to-date, very earthly recommendations, but the patient with higher education should be treated in different manner. Share information. So the patient should understand everything. That's why you have to understand. You have to explain it in his own words, in the patient's understandable words. Every process, well, not every, but most of the processes that happen in his or her body. So then you should reach agreement with the patient. Reach agreement. What is it? You should develop a consensus between you and your patient so that your patient can go through your treatment without any problems, without a hassle. And then provide closure, provide closure. You should always ask the patient, do you have anything else to tell me? Anything else? Do you have any hidden concerns? Any hidden problems? And this will be very good for you. You will be an attentive doctor. You will have a glory of attentive doctor. You will be considered an attentive doctor. Well, this is the framework, just mnemonic. Set the stage, elicit information, give information, understand the patient's perspective, and end the encounter. It's a mnemonic just for communicating with the patients. Well, habits of highly respectful physicians. They are relevant for students as well. Ask permission to enter the room. Introduce yourselves. Introduce yourself. You can just tell, we are students, but we would like to talk to you. Yes, and the patients usually here in Russia, when you say that you are foreign students, the patients get more interested. Yes, because they are not xenophobic. Yes, despite the some abominable cases of hostility and aggression towards foreigners, I mean Malaysian foreigners, are absolutely innocent in every sense. Well, the most of the population feels some, liking towards foreign people, and of course they will be more willing to talk to you than to the Russian students. So shake hands with your patient. Well, I think that in Malaysia it's a tradition, but it's not a tradition here in Russia. That's why, well, it would be wise if you don't shake hands with the patients. It's a bit, superfluous. They don't need it. They don't understand this gesture. Then sit down and smile if appropriate. Yes. And briefly explain your role. Briefly explain your role. So I'm a student, I would like to talk to you. Yes, please tell me everything, and it will be easier for you if you tell something to other person. It is easier to cope with the disease. Yes, you can tell them this, and they will believe you because it's true. And ask the patient how the patient feels about being in hospital. Yes, it's also very important, but we'll dwell on it a bit later. So, from patients, yes, we'll just come to the recommended books. Yes, to the recommended books. So, the Bible of Internal Medicine is Harrison's Internal Medicine book. In September of this year, we'll have a new edition of Harrison's, the 18th one. Yes, and it is promising to be very, very interesting. They will have an additional DVD with 50 additional chapters. It will be very up-to-date. It will be very exhaustive source. Yes, so of course, it shouldn't be the main source of your studies, because sometimes they have 40 or 50 pages on a topic. Yes, and of course it's very difficult to go through all those pages. So this should be only as an additional source of information. But your main sources of information on internal medicine should be two books. Yes, Davidson and Kumar and Clark. So Davidson is respected in Great Britain, Kumar and Clark is respected in the United States, but ideally you can use both textbooks. You can take information on topic from one book and from the other book and just make a short synthesis of this information. Because when you look at some problem from different aspects, from different angles of view, it's always better. It's always more insightful than you just read only one book and you think that everything is okay with one book. Yes. Among the books clinical skills, I would recommend DECO in diagnostic examination. Yes, I would recommend Bates Guide to Physical Examination, and for in-depth reading, I recommend Sapira's Art and Science of Bedside Diagnosis. Well, DeGoin is the most understandable book. Bates' Guide to Physical Examination is very comprehensive, but it's a classical book, yes, so I recommend it for getting the in-depth information about physical exam. And if you want to just to read a very artful book, to get an artful reading, to get some very good insight, yes, you can read the Sapira's book. We'll discuss these books during our next meetings. Okay, so no medical student, no good doctor is possible without updating knowledge. Yes, because Kumaran, Clark, Davidson, Harrison, they are published every 3 or 4 years, but medical journals are published every week. Yes, for example, the best medical journal, the most respected medical journal is New England Journal of Medicine, widely recognized. So what interesting things can you get from the New England Journal of Medicine? Very important review articles, but I would like to draw your attention just to 2 sections of New England Journal of Medicine. Clinical cases section, clinical cases, yes, and you can get the listing of clinical sections in the articles section. You see home articles, issues, and so on, and you see the menu articles. You can just press clinical cases. You can browse clinical cases. Especially, I recommend you case recordings of the Massachusetts General Hospital. They are published once a month, and they have been published for 50 or 60 or 70 years. Yes, and they're absolutely brilliant. But they also have very important and very interesting articles, very interesting series of articles, which is called Clinical Practice on New England Journal of Medicine. This clinical practice consists of the reasoning stages. So they introduce the patient gradually. So they introduce the patient's complaints, they stop and they say, these complaints may be due to this, and that. To reveal further causes, we can do this, and that. Then they perform some investigations, they list the results, and then they just comment on this. This is called clinical reasoning, and this clinical reasoning is very